Moving on, Nigeria's Federal Ministry of Health and Borno State Government are taking proactive measures to curtail the increasing number of victims of diphtheria in the country. Nigeria's Coordinating Minister of Health, Professor Ali Pate, made this known when he visited Borno State to commiserate with the people and government there over the recent demise of a renowned health expert, Professor Emeritus Umaru Shehu. Let's join News Central's Umaru Kirawa, who sent in this report.
The outbreak and the recent increasing cases of diphtheria in Nigeria has become a public health concern. The visit by Nigeria's Coordinating Minister of Health to the ancient city of Maiduguri is part of a move to proactively tackle the disease. Early detection, prevention, and most importantly, vaccination is said to be key in tackling the spread of the disease.
The health workers are supported to do that. That's an advocacy that we would like to put forth for you.
Individuals exhibiting symptoms of diphtheria have been advised to isolate themselves and report to the nearest health centers.
My preoccupation in the sector now is system strengthening to make it result-oriented. Accordingly, government has reconstructed and equipped at least 80 primary healthcare centers in Borno State. Bearing in mind that there should be at least one PHC per ward. Employed over 2,000 health personnel within appropriate academics, drugs including free drugs and consumables for pregnant women, mothers and children under 5 years of age are provided. Recently, over 800 million worth of free maternal drugs and consumables have recently been procured.
Borno State Governor insisted the need for effective coordination of the health sector for better service delivery, enhanced collaboration and strengthening public health response, particularly the primary health care system, is one of the major ways which the governor emphasized must be taken seriously.
The state has a robust outbreak response system in place with best of coordinating facilities, a public health emergency operation center, and that of polio. It is pertinent to mention here that the state cannot do all this alone without acknowledging the support from the Federal Ministry of Health, National Primary Healthcare Development Agency, National Center for Disease Control, and partners. The collaborations have been very remarkable, and we can only crack for more support. I therefore want to seize the opportunity of the Minister's visit to request for more support to the sector, particularly in the areas of medical emergencies and referral services by supporting the state with ambulances, upgrading of our public health molecular laboratories, allocations of more vaccines for outbreak responses, establishment of federal medical centers, amongst others.
World Health Organization and other international partners were part of the emergency response team in the state, which have pledged to support to tackle the disease. Umaru Kirawa, reporting for News Central TV, Maiduguri.
To help us understand this development, we are being joined by a medical doctor, Dr. Sadiq Wajiro. Thank you very much for your time. What are your thoughts on the recent proactive measures taken by Nigeria's government through the Ministry of Health and the Borno State Government in combating diphtheria in Nigeria? Okay, sir, can you kindly unmute yourself? I think that it's affecting the connection. All right, if you just,
yes.
Can you hear me?
Yes, I can hear you. I'm with you.
All right.
And thank you very much for having me.
All right, so please go on and help us share your thoughts with us regarding the measures, the proactive measures taken by Nigeria's Health Ministry and the Borno State Government in tackling the issue of diphtheria in that state and across Nigeria.
First and foremost, I would like to commend the Honorable Minister of the Federal Republic of Nigeria of Health and the Borno State Governor. Currently, there are diphtheria teams set in almost every state, more especially Borno State, where the team are moving to various health facilities and preparing, educating, and enlightening the health workers on how to specifically treat the diseases. And also, so far, there is advocacy and sensitization to the public through the media on the preventive measures of diphtheria, and also awareness are being carried out to enlighten people on the signs and symptoms of diphtheria. There are also isolation centers that will help prevent the diseases. Thank you.
All right, Sadiq, Wajiro, what steps are being taken to improve early diagnosis in affected areas, particularly rural areas? In your opinion, what role or does community education and awareness play in reducing the incidence of diphtheria?
Actually, early detection help save lives. Early detection help prevent the disease from becoming chronic. So currently, rural areas are being educated on the signs and symptoms and the importance of reporting as early as possible. I can tell you that the communities I've visited so far enlightened, are so far aware of the basic signs and symptoms, and there are health captains who are readily available for people to report to.
And how do you see the long-term outlook for diphtheria control in Nigeria? What measures are being taken to sustain the progress made?
Actually, diphtheria is a vaccine preventable disease, and I believe in our primary health care, in our secondary and tertiary healthcare agents assistants, there are vaccination teams, vaccination centers readily available. I think once the general population imbibe the habit of vaccination, that will, of course, prevent the disease. Because once children are vaccinated at the appropriate time of 6 weeks, 10 weeks, and 14 weeks, then I think we won't experience an outbreak of the diphtheria disease.
Right. Sadiq Wajiro, medical doctor, thank you very much for joining us.
Thank you very much. I'm grateful.